Have you ever hurt your heart? Like it just felt like your heart was just torn out from inside of your chest? Well, you are one of 11 million people in the United States alone because those people experience what's called angina, which literally translates to chest pain. And angina is very closely linked to a myocardial infarction, which remember, that's a heart attack. And we remember from this video here that a myocardial infarction occurs when there's a lack of blood flow to the heart muscle tissue itself. So let's see how angina is actually caused by that lack of blood flow. So normally functioning, the coronary arteries, vessels will carry blood to the heart muscle tissue itself. That's important so that the heart has blood so it can beat properly and continue to work. But when you have angina, what's usually causing it is you will have a lack of blood flow to the heart due to these plaques building up in the coronary arteries. And a lot of the time, this plaque is made of LDL and other types of clotting factors. So these are things like platelets and fibrin, which we talked about in the previous video. Now, when that happens, you are going to diminish the amount of blood flow to the heart. And when you diminish that blood flow so the heart isn't getting enough blood, well, now the heart appears sad. The cells there that are actually beating, doing the work, they're going to be starved out of their oxygen supply. And when the heart gets sad due to this lack of blood supply, what's interesting is there's going to be some sensory neurons, which remember send signals to the brain about what's going on in your body. And these sensory neurons are going to send signals up to your brain through your spinal cord and basically tell your brain, yo, we're in pain. Okay, so once that signal gets to the brain, you experience that as pain. Now, studies have shown we really don't know why or how that process occurs, but it's linked to that lack of blood flow. These cells basically get starved out of nutrients and that signal is sent. So the question is, how do we treat this condition? So if you've got a plaque, you've got some lack of blood supply going to the heart, how do we treat it? To remember it, I want you to remember the acronym BLOB. Yes, BLOB. BLOB, B-L-O-B, will stand for the first letter of all these different treatment options. And we're going to increase them in terms of severity. The first thing I talk about will be basically the easy treatment we'll give to a person first, towards the end, which will actually be more close to medical intervention, close to hospitalization, okay? So let's get started. B, the first B, this is going to stand for blood pressure medications. Now, if you want to learn more about blood pressure medications, I would recommend you watch this video first. It'll go into more detail, but the two blood pressure medications for specifically angina are going to be ACE inhibitors as well as beta blockers. Now, why specifically these two? Well, ACE inhibitors will exert what's called a vasodilatory effect throughout your body. So break the word down, vasodilate basically means blood vessels opening. So what will it do? Well, it'll go to a variety of different blood vessels and open them up. And if you think about it, if we open these up a little more, it'll feed the heart better and put less strain on the heart tissue itself. So that's one great medication. The second one, beta blockers, this is going to do a couple things. It'll slow the heart rate as well as decrease its strength of contractions. Okay, so why are we doing these things? Well, if you watch the previous video, slowing the heart rate is very important because the blood actually feeds the heart in between beats. So if we slow the heart rate down, the heart's resting more. Therefore, more blood will be getting to the heart tissue itself, thus fixing the problem. And then if we decrease its contractility, how hard it's working, well, it's going to have less demand for oxygen. So therefore, even if you have a block there, it's still not going to demand as much oxygen from the blood as it needed previously. So that's why we give those blood pressure medications. Now, the second one, the L in BLOB, is going to be LDL lowering. So LDL lowering, remember LDL stands for low density lipoprotein, which is basically a type of cholesterol. And what cholesterol does sometimes if in excess in the bloodstream is it sticks to the arteries, causing these plaques, causing all that sorts of crud. So if we have an LDL lowering drug, it's going to prevent that from forming. What are these called? Statins. Okay, so what do statins do? Well, the liver, normally functioning, will actually be pumping some of this cholesterol into your bloodstream constantly. And what statins do is it blocks the liver's ability to make that cholesterol, thus lowering the risk that you will form these types of clots. So these are the two conservative treatments. Now let's get into a little more dire situations here. So next up we've got the O, which is going to stand for open blood vessels. Now you may have the question, well, Mr. J, didn't we already talk about opening up the blood vessels with the vasodilation? Yes, but this is going to be more in dire circumstances because a medication that can be taken to really immediately open blood vessels will be called nitroglycerin. Now nitroglycerin is going to open up these blood vessels through increasing what's called nitric oxide production. Nitric oxide specifically goes to a bunch of different blood vessels and tells them open up just like the ACE inhibitors did. But this one's much more rapid in its effect. Now, how can we get this into the body rapidly, say during unstable angina where you have pain in your chest just at rest, as well as on the verge of or in the middle of a myocardial infarction, a heart attack? Well, we can give them tablets of nitroglycerin because nitroglycerin is rapidly absorbed actually through the oral cavity itself, the oral epithelium. So if you just put like a tablet under the tongue of a person with a heart attack, it's going to immediately get in the bloodstream, immediately start opening up those blood vessels, getting blood flow to the heart muscle tissue, which is great. Now, in an even more dire situation, we can actually give it intramuscularly. That's through an injection specifically into the muscles, and it's going to rapidly get into the bloodstream to open up those blood vessels. Once again, this is in dire situations, but at the same time, we can naturally boost our nitric oxide production by eating one very good food. Dark chocolate, one of my favorites. And I'm talking like the 92% intense dark from Ghirardelli, right? Now, with dark chocolate, that directly opens up your blood vessels by producing more nitric oxide. So it's part of it, actually, a heart-healthy diet for that reason. Wonderful. Now, last but not least, the last B. Now, this is going to be blood thinners. Now, all these medications are going to deal with making your blood a little more slippery, a little more resistant to clotting up like it did there. So we're going to talk about three main medications. The first one being aspirin. Now, what aspirin does is it makes your blood slippery by basically decreasing the amount of platelets in your blood. In the previous video, I talked about platelets being basically those little things that can cover up that clot itself and secure it, and we don't want that to happen with this type of disease. So we're going to decrease platelet amount, make the blood a little more slippery. Wonderful. Now, the second one is going to be clot busters. Now, if I've been busting through some clots in your mind, terrible segue, please like this video and subscribe if it's being helpful. What clot busters do is, wow, what a thought. They directly act on these clots and begin breaking them up. Now, the way they do that is through directly breaking up different fibers and proteins that deal with blood clotting. So the way you'll hear these described is as thrombolytics, which thrombus basically means clot, and lytic means lyse, to burst, or you also hear fibrinolytics. Fibrin is that protein that helps secure blood clots, and lytic, once again, means to break. So these two classes are going to break up those clots in those vessels. Wonderful. And the last one I'm going to talk about will be called heparin. Now, this is actually a medication that's usually given to patients during like open surgeries where they're cutting open a lot of different tissues because it's going to prevent that blood clotting possibility, because blood clots are very common during surgery, so they got to thin it up really well with heparin. So this can kind of be a last-ditch resort if somebody has a really bad unstable angina or a heart attack going on. This can be given intravenously in a hospitalized setting. So now that we know some treatment options for angina kind of teetering towards a heart attack, let's talk about some actual surgical interventions to help patients who are actually experiencing a heart attack next.